I'm so glad I found this radio station.
Canton's Morning News, live and local with Jordan Miller, and the Kenny and JT Show.
I like that it's local.
Local issues and community information. This is the right place. News Talk 1480 WHBC. This is the right place.
The following program is sponsored by the Medicine Center Pharmacies.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us this morning. It's the 10th anniversary of our Health Matters show and the 45th anniversary of our company. Today we're featuring a program about diabetes and our diabetes care program, one of the programs that we feel is most important to the community we serve. Before we begin, I'd like to thank our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and, of course, our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our guests are Nicole Solinsky, diabetes educator and licensed dietitian at Cleveland Clinic Mercy Hospital, and Doug Kuzik, vice president of business development at Gemco Medical. Good morning, Nicole and Doug. Welcome back to the show, both of you.
Morning. Diabetes statistics are some pretty humbling numbers. 34.2 million, almost 11% of the population has diabetes. And those statistics do not include the additional 88 million Americans with prediabetes. Almost 27% of senior citizens in the United States have diabetes, and there has been a startling increase in type 2 diabetes among children and adolescents aged 10 to 19. While those numbers are indeed humbling, it's important to remember that diabetes can be managed and controlled. This morning, we're going to talk with Nicole and Doug about managing and controlling diabetes. We'd like to remind our listeners that today's program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
It's an exciting time in our pharmacy as we celebrate our 45th anniversary by giving away $45 gift certificates to anyone who stops in to register for them. I would like to take a moment and announce the winners of this week's 45th anniversary drawings. At our Canton location, Lisa Fox from Canton is the winner of a $45 gift certificate at Lindsay's Restaurant. At our Minerva location, Gloria Martinelli from Minerva is the winner of a $45 gift certificate at Kishman's IGA. And at our Louisville location, Nora Stringer from East Canton is the winner of a $45 gift certificate at Grinders Above and Beyond. So please stop by and register so you have a chance of winning next week. We are giving away gift certificates to Lindsay's Restaurant, Anastasiades Chocolates, Grinders and Above and Beyond, and Kishman IGA. So, Nicole, welcome back to the show. You've been on a couple times. We're very happy to have you back. And thank you for your service to the community during this pandemic and everything that's going on around it. You and all our healthcare workers are appreciated. Please tell us a little bit about yourself and introduce yourself to our listeners.
Well, thank you again so much for having me. I enjoy doing the show with you guys. As you said, my name is Nicole Solinsky. I'm with Mercy Medical Center, Cleveland Clinic Hospital. I'm a registered licensed dietitian. I'm also a certified lactation consultant. I currently hold the role of the diabetes education coordinator here at the hospital. I've been here 21 years. I'm a wife, and I have 3 great kids. So thank you again for having me.
So, Doug, welcome back to the show as well. Give us a little bit about yourself and introduce yourself to our listeners.
Yeah, well, first of all, thank you for having me. I'm Doug Kuzik, Vice President of Business Development for Gemco Medical. I've been with Gemco Medical about 15 years. Gemco Medical is a large distributor of diabetes supplies for nationwide. Before that, I was with Bayer Healthcare. I was with them for 20 years. That's the Bayer Cross, the Bayer Aspirin company. But I was in their diabetes diagnostics division, where I helped them develop multiple blood glucose meters. And I joined Gemco Medical about 15 years ago, and I helped them develop the EasyMax meter, which we're going to be talking about today in today's broadcast.
Okay. For our listeners, you may wonder about the pairing of our guest today. One pharmacy features a diabetes care kit from our newly diagnosed diabetes. This includes a free talking meter, a free box of 50 strips, a lancing device, lancets, and glucose tablets. Nicole shares these gifts with patients at Cleveland Clinic Mercy Hospital, and Doug and Gemco Medical are integral as their company launched the meter and our primary supplier for diabetes meters and strips. So, Nicole, let's take a moment and go over the basics. Can you tell our listeners what diabetes is and the difference between pre-diabetes, type 1, type 2 diabetes?
Sure. Diabetes simply is a metabolic disorder characterized by abnormally high blood sugar levels. Our body uses glucose, which is a type of sugar, for energy for all of our body's functions. And as a diabetic, you're either not using that energy appropriately or effectively, and that can cause a lot of problems. When we break it down, basically pre-diabetes is kind of like your big warning sign. You're on your way to developing diabetes. Your numbers aren't in the normal range. They aren't quite in the diabetic range, but they're on their way. Type 1 diabetes is more of an autoimmune disease. It's basically characterized by when your pancreas stops making insulin, and insulin is responsible for getting that sugar out of your bloodstream so we can use it for energy. It used to be called juvenile diabetes, but they're finding that, not just children get it, so it's called type 1 diabetes currently. And type 2 diabetes is characterized by not only not making maybe enough insulin, but by insulin resistance. So that insulin is there, it's just not able to be used effectively or properly to get our blood sugar levels down the way they need to be.
So, Nicole, what's the best way to stop pre-diabetes and obviously becoming diabetic?
Yes. What people don't realize is that, if you are diagnosed with prediabetes, it's pretty important to understand that if you don't do something about it, you will become diabetic. That's pretty certain. It's not necessarily a specific timeline. So the biggest things that you can do to prevent that is really work on, your diet, changing some things up, making it a little bit healthier. Moving as much as possible. When we move, we use energy, and energy is that sugar. And really starting to get yourself educated about what diabetes is and how you can manage the disease moving forward.
So our listeners may not understand what a diabetes educator is and how they can help a patient. Can you explain how a diabetes educator can help a patient prevent full-blown diabetes if they've been diagnosed as prediabetes?
Yes, our job is to help our patients manage their diabetes easier, more effectively. We give them the time. We work with them individually to come up with, plans that work for them in their real life. As I said, we really have time to listen and sit with them and understand and meet them where they're at. And really our job is to equip them with the tools that they need and the support that they need, moving forward in their diabetes care.
So let's talk about testing. Can you explain the benefits of testing and how frequently a patient should check?
Well, I'm a big fan of monitoring because I feel like if you don't understand what your numbers are, then you're kind of flying blind. Monitoring really helps patients, know how food, activity, stress, medication, all of these things can affect their blood sugar every day. It helps them really identify patterns to make decisions about the steps that they can use to take control of their blood sugar levels. When we talk about how often you should be checking, it kind of depends. The standards of care by American Diabetes Association depends on, if you're on medication, if you're on insulin. So if you're not on any medication and just kind of working with diet only, the recommendations are to try and be testing at least once a day. If you're on any kind of pill form of medication or what we call a non-insulin injectable, the recommendations are to be testing twice a day. And then if you are on any kind of insulin, that kind of moves up to testing 3 or 4 times a day.
Okay. Hey, Doug, we're very proud with the partnership we have with Gemco and the success of our diabetes care kits. Can you talk to the listeners about the features of the EasyMax meter and the accuracy as compared to other brand name glucose monitors?
Yeah, EasyMax is has all the latest technology, equal to any of the brands, and equals in accuracy. It's some of the features are it's a very, very small drop of blood. It's like 0.6 microliters, so it's tiny sample size. It's a quick test. It's 5-second test time. There's no coding required. One of the key features of the meter is it's got a very large strip, so it's easy to handle when you're putting it into the meter. It's got a 480 test memory, so it has all the features of any of the current brands that are on the market.
So how about we speak to the affordability of the EasyMax testing system compared to other brand name meters?
Yeah, the beauty of EasyMax is that it is it's the quality of a brand, but it's about 1/5 the cost. So it allows you to be able to test your blood sugars as many times as you need to, based on your condition. So that's the beauty of there's no it being so much less expensive than the current brands that are on the market.
Okay.
This week we have. And promoting our 45th anniversary, we have a promotion on the strips. If you buy a box, you get one free. So that's less than 3 cents a test. And I can remember in the past where, with some of the other monitors where people came into the store and said, well, I just ruined a strip and you lost $1 or something like that. And then this whole concept of the EasyMax is just fabulous.
So, Nicole, as an educator and clinician, how important is affordability in helping patients manage their diabetes?
Oh, Brad, it's extremely important. We have all levels of patients, but, diabetes can be expensive. Your medications, your supplies, if you're on insulin, any diet changes, and things like that. So the research really shows that people who struggle with affordability, you have a harder time maintaining good blood control. They might have to skip a dose of insulin to make it last or adjust that down or up, half medications, things like that. So it's really important for them to be able to have as much cost effectiveness in everything that they're doing with their diabetes management.
Okay. Well, as we just mentioned, I want to highlight that we are excited to share as part of our anniversary. We're currently offering buy one, get one free on the EasyMax test strips. If you stop in at any of our Medicine Center Pharmacy locations in Minerva, Canton, Louisville, or New Philadelphia, talk with one of our staff and we can help you with this promotion. Doug, if a listener wants to switch to an EasyMax meter from another brand, do you recommend testing on both meters for a few days to make sure the readings are consistent?
Yeah, that is not necessary. The meter, the EasyMax meter, is a highly accurate system. And also, between meters, there can be slight variations. So you really want to use the same meter all the time as you're looking for patterns with your blood glucose, test results. So it's more important to stay on once you switch to a new meter, you stay on that meter, on that system. There's no need to be comparing one to the other.
I guess we take a break here. You are listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Hot Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. Everyone has been tuned in to where to get their COVID vaccine. We've been proud to serve the community in this process. The Medicine Center offers many other vaccines like shingles, influenza, pneumonia, Tdap, meningitis, MMR, hepatitis A and B, and travel vaccines. Do you need a vaccine? Give us a call at the pharmacy or visit our website at medshoprx.com to schedule your appointment. Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. It's our 45th anniversary, and we'd like to invite you to transfer a prescription to the Medicine Center Pharmacy and receive a $25 gift certificate. It's simple. Just call, and our pharmacist will take care of it.
All right, Doug, let's talk about some other things on your EasyMax testing. Should samples always be taken from the fingertip, or can you use alternate sites?
The EasyMax meter is approved for alternate site testing for both the palm, the forearm, and the thigh. And the only thing we recommend is that whatever site you do choose, you should be consistent, because there can be some slight differences between a finger stick versus a thigh or a forearm test blood sample. So just be consistent. So you're comparing result to result, and you're looking for patterns.
So, Nicole, what's the optimal range a patient is hoping to see when they test their blood glucose? And what's too low and what's too high?
So it depends on when you're testing. If you're testing, a fasting blood sugar, which is, ideally that sugar you check first thing in the morning before you eat or drink, the number that you would for, according to American Diabetes Association, is between 70 to 130. That would be a normal range for a fasting blood sugar. If you were checking after you eat, or a postprandial number, checking that 2 hours after the start time of your meal, the number that we would want to see would be between 70 and 180. And then if you were checking at bedtime, right before you go to bed, it's between 100 and 140. So people need to understand that there's a little bit different ranges that you're looking for at the different times that you're testing. And if we're looking at what would be too low, 70 or below is considered, what we call hypoglycemic, where we need to look at treating for that. And too high, anything that are kind of out of that range is considered higher than it should be.
Geez, I think if my blood glucose tested 70, I'd be on the floor. Is that for real?
Oh, that is for real. And it is individualized. But if somebody's running really high in the 400s and then they go down to a normal range, they're probably going to feel, hypoglycemic at the beginning. That's why we really want to bring people down at a safe, consistent level, so their body can adjust to the more normalized numbers as well.
Okay. If it's too low, do I call the doctor or do I call you?
Well, first we want you to, check your sugar and make sure, that's what's going on. Kind of know those signs and symptoms. Do you feel dizzy, shaky, anxious, nervous, tired, grouchy, lightheaded, sweaty, hungry, confused, or weak. Those are all signs of beginning, hypoglycemia. We can also feel those things from, other reasons. So pulling out that meter and checking your sugar is a good way to determine, really what the cause is. So if you're close to that 70 or below, that's what we consider is too low, where you need to treat for that. And that's what you would want to do.
Okay. Certain drug drugs would cause your blood glucose, like a prednisone product, to really just go to the moon. Okay, so if you're prescribed a product like that and your blood glucose goes to 400, what's the next move?
Well, definitely be aware that that medication is probably going to affect your blood sugar is important. A lot of times talking to your physician, talking through them, like, do they want to do an adjustment of an insulin or a medication, during that time that you're taking that steroid or, whatever that medication might be. That's important to do before you start taking it, knowing that it can happen. And then, having that, if it goes too low, knowing how to treat that. And then if it goes too high, kind of knowing when the doctor wants you to be calling in and getting taken care of.
So if you had to throw a number out there, what would be the high number that you'd want me to call the doctor?
Well, when we look at kind of the general ADA standards, anything that is consistently 240 or above is kind of that 6-day rule plan where you would want to kind of, make that doctor aware of what's going on. But again, diabetes is not a one-size-fits-all, so I really encourage all of my patients to have those discussions with their, care providers so that they're on the same page and they can be, they know what the doctor is expecting and what they think for them.
As a company, we started with one of the very first liquid crystal glucose display monitors, okay? And this was a long time ago. And there was an awful lot of hey, this meter's defective, or it doesn't, give me an accurate reading and whatever. How do we care for our meter and the strips and all that sort of thing?
Yeah, the taking care of the strips are the most important part. The strips are made of enzymes, and enzymes can be denatured, and so it's important that you keep your bottle and with the lid on nice and tight, so that no moisture can get in. Moisture can affect the enzymes. Temperature can affect the enzymes. So if it's too hot, so you want to keep your strips in a cool, dry place. That's most important. As for the meter, the main thing with the meter, you don't want to get any water into the opening where the strip goes in. That can affect the electronics. So if your meter gets dirty, you just use a damp cloth to wipe it down, and just being careful not to get water in. But the strips are the most important. You have to make sure that they don't get ruined, because that will affect the results.
So, okay, I'm testing from my fingertip. It has to be dry, not wet, right? If your hands are wet or your fingers are wet, it's going to affect the test, right?
That's correct. Yeah, you want your finger to be dry, because obviously the water will affect the results.
I do notice that the container that holds the strips is very tight. It like snaps shut and pops open. So there surely is a terrific seal there on the package. The only problem is my fingers are too big to pull the strip out of the container.
Yeah, you have to be careful. There's ways if you're going to tip it over to get a strip out, you just got to make sure you get them back in and get that lid back on. But that lid is very important to keep on to make sure no moisture gets into the bottle itself.
Okay, we got to jump over to the news here. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for StatCare Urgent Care 7 days a week and Mercy Primary Care, Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Poison ivy can be a real pain and very hard to deal with. Hi, Paul White from the Medicine Center Pharmacy. Let me recommend a product that I have personally used. Poison ivy pills. This homeopathic remedy prevents and treats the effects of poison ivy, oak, and sumac. It's completely safe for adults and children, and there aren't any side effects, so ditch the itch and get relief with poison ivy pills at the Medicine Center Pharmacies in Canton, Louisville, and Minerva, where wellness begins.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Okay, we're talking this morning with Nicole Solinsky and Doug Kuzik. We have a lot more to cover this morning, so let's get back to the show.
So do you have any tips for patients to get consistently more accurate results out of your EasyMax blood glucose monitor?
Sorry, Brad, just repeat that question.
No problem. Do you have any tips for getting consistently accurate results from your EasyMax blood glucose monitor?
It's really just getting a proper sample size. Make sure you get a proper sample size, and you're consistent in terms of where you're getting your results, and obviously just keeping your meter nice and clean and keeping your strips in a cool, dry place. But those are the main things. A good sample size is probably the most important.
Okay. Nicole, the goal in controlling diabetes is managing blood glucose numbers. What do you believe is the key to achieving that control?
Well, the biggest thing in diabetes management across the board is to try and be as consistent as possible in everything that you're doing. Meal timing of your medications, timing of properly exercise, things like that. So the more consistent that you can be, the more control you're going to be. And really knowing your body's responses and learning how your body feels when your sugars are normal, when they might be running low, or so on. We don't really pay attention to that too much. We just kind of go about our day, and, there's usually patterns and things like that happen within all of us. So really kind of paying attention to that. So consistency and knowing your body, I think, are the two biggies.
I have to mention the story that happened to me in the pharmacy yesterday, and I'm confident you have a response to this. But I had a patient come in who said their numbers were high in the morning, and they were concerned about it, so they were going to skip lunch. Can you talk about skipping meals and why that's a bad thing for a patient with diabetes?
Absolutely. I get that a lot. Or they'll just skip or add more medication or do something crazy. What people don't understand is that, glucose is the number one source of all of our body's functions. So if you start messing with it and not eating or going long time between meals, you're really messing with how your body is able to use that energy. So, that's probably one of the worst things that you can do, because that's kind of one of the number one rules of diabetes management, is to try and have as most consistent meals as possible, kind of within that 4 or 5 hour range, to keep your blood sugar, as level as you possibly can throughout the day. And then you get these highs, and then you get these lows, and then you kind of are on this roller coaster ride that your body's constantly trying to offset.
So speaking of diet and the quality of diet, occasionally we also hear in the pharmacy from patients that are just destitute because they feel like they can't have any of the good stuff anymore. Can you speak just briefly to managing your diet and how some changes you can recommend, but some changes maybe you can still indulge in, if that's fair?
There's a lot of myths out there about, food and how you need to control your diabetes and things like that. Our approach here is, really real life, because diabetes is kind of forever, so we need to kind of be monitoring all the time. So how can we adjust it to make it successful long term? And that doesn't mean getting rid of all the good stuff. It might mean adjusting how much of it or how often you might be having those things. And it's really about balancing. There's not one thing that you can never have as a diabetic, and that's really important to understand. And that's why maybe coming to see, myself or one of the outpatient dietitians here, we can really help you kind of navigate through all of the information that can be very confusing and overwhelming out there. That people are faced with, whether it's from the internet or, friends, family, whatever. So, really understanding there's not one thing that you have to give up forever, balancing within your food groups, consistency with your meals, and just making some changes that, can help you monitor and control in a better manner.
It's interesting you mention that, because I'm just thinking about myself. I don't have a diabetes diagnosis, but I know how much my metabolism has changed over the last 5 or 10 years as I've gotten older. So you combine that with a patient who maybe has been diagnosed with prediabetes or diabetes, and it probably just makes that challenge even more difficult. So I do think it's important that people are humble and realize that there's no harm in going to see an expert like yourself or a dietitian to get some tips on how to manage what they eat, because I've had people come in the pharmacy before that didn't really understand what protein sources were, or didn't understand what carbohydrates were. And it probably begs the discussion that we ought to talk about beverages. So why don't you talk about how what you drink can really have an impact on blood sugars and how they can affect blood sugar control?
Absolutely. Especially in our day and age today, with all of our, frou-frou coffee drinks and, some of all of our juices and Gatorades and, all of these energy drinks and things like that, they're just really, really full of sugar. And, when we think about how we treat a low sugar, we drink something that has sugar, a small amount, to bring it up. So if you're constantly putting that sugar directly in your bloodstream, you're really, really overtaxing your pancreas to have to produce that insulin to get rid of that sugar. And that's how diabetes can progress. Diabetes is a progressive disease. So if you're constantly putting that sugar into your blood, you're going to probably progress a little bit quicker than maybe somebody who's monitoring that. Fun fact, yesterday I just saw that 17 glazed donuts is 187 grams of sugar, which is the same amount as a Dunkin' Donut pumpkin swirl frozen coffee with cream. So you drink that sugar, drink that drink, that is the same amount of sugar as eating 17 glazed donuts. So people really need to understand, kind of check that out. Think about your drink.
Staggering. That is
oh my
staggering.
God, that's even funny. It is funny, but it's not. Okay,
oh my.
We're in the middle of sugar. What about substitutes?
Okay.
I personally like stevia. I don't know, where we are with the others, but
we have, there's a lot of people who have different, feelings on that. But when you look at the facts of how it can impact your sugar or not, Artificial sweeteners can have a role in helping people manage their blood sugar a little bit better. When we look at what are maybe the more recommended, the stevia, the sweeteners that are made from stevia, which is more of that natural plant, are the ones that are probably recommended the most for people to use. The other ones out there, can have a role, but it's not something that we should have in everything that we eat or drink throughout the day, but it definitely can play a role in helping somebody, especially come off of some of the sugary drinks like, colas or sweet tea or things like that, people are trying to decrease, but they need to do it in a way that they're going to be successful long term.
Well, the cola's like sugar, like I'll say Coke. What the heck? It's got like 10 teaspoons full of sugar in one container, and I'm thinking, how do they get 10 teaspoons full of sugar in there, and dissolve it? It just, so I switched a long time ago to diet products, and now I'm over to water. So best move, I guess, huh?
Sometimes it needs to be that progression, so for sure.
Yeah.
What patient?
Well, speaking of snacks and things, it's a lot of people are on the go and they're busy, and, maybe they're trying to plan for having a snack in the afternoon, or maybe they're traveling, or they want to have something on hand after exercise. You speak about that crazy sugar in the beverage. I was devastated the other day to look at one of my favorite protein bars had 14 grams of sugar in it. And I just thought, oh, my gosh. I mean, do you have tips for people, regardless of if you have diabetes, that would be a healthy snack to have on hand that's got a nice balance and isn't going to give your pancreas that punch in the nose? And diabetic or not, that's a good point. A good way to pair things is to have a healthy carbohydrate choice along with a protein source or a healthy fat, because that helps to really stabilize your sugar. Diabetic or not, our sugars need to be stabilized. So when we talk about that would be, for example, maybe a handful of nuts or almonds with an apple, or, some peanut butter on a few crackers, a string cheese with a yogurt. You could do some vegetables with hummus. Hard-boiled egg would be like a good protein source, and have, maybe a different type of fruit, or, a whole grain cracker or something like that. So really pairing that carb with that protein is really a key balance.
What's your thinking on these glucose control liquids? Okay. There's some brand names out there, and I'll throw it out there, Boost, for no other reason. They have 180 calories, something, protein, that sort of thing.
Yeah. There's a place for those at certain points. I'm not a fan of replacing all your meals with those kinds of things, but, I'm also realistic. There's people that skip breakfast. They're quick, they're easy, they need something on the go, and they really do have a decent balance of, the carb with the protein that's going to help to sustain their sugar, much better than, if they would skip a meal and not eat for 5 or 6 hours. So, there definitely can be a place and a role in that, and that's something that we often help our patients kind of navigate through with their choices.
Final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center Pharmacies, we give you, at no charge, a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand name test strips. So stop in any Medicine Center pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin, or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Poison ivy can be a real pain and very hard to deal with. Hi, Paul White from the Medicine Center Pharmacy. Let me recommend a product that I have personally used, Poison Ivy Pills. This homeopathic remedy prevents and treats the effects of poison ivy, oak, and sumac. It's completely safe for adults and children, and there aren't any side effects, so ditch the itch and get relief with Poison Ivy Pills at the Medicine Center Pharmacies in Canton, Louisville, and Minerva, where wellness begins.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Okay, we are back to our final segment of the show. We're about at the end of the vacation season, so travel, heat, humidity impact both diabetes control and care for diabetes equipment when you travel. So, Nicole, what about a comment on managing diabetes on vacation when both diet, exercise may be impaired? You're out there, you got to eat anywhere you eat, and you're eating a lot of stuff that you don't normally eat at home. So, and as a follow-up from Doug, keeping your meter and strips safe while traveling, temperatures, high, low, cold, whatever, both impact testing. So humidity, low temperatures, all that stuff. What's the scoop?
This thing when you're on vacation is, obviously our patterns change, our schedules change, things like that. Trying to think a little bit ahead of, if you're going to be traveling, packing some snacks, keeping some bars or, some of those quick, easy things that I just mentioned a little bit ago on hand. Knowing that you're probably going to be a little off on your food choices and maybe offsetting that with, a little bit more exercise here and there. Enjoying your vacation, but, not going super crazy so you're coming back and having to undo, a lot of stuff that you maybe have drank or ate that you didn't. So really just kind of thinking ahead and planning and, enjoying yourself, but also not going too overboard.
And just talking about your blood glucose system, the Easy Max, you want to be able to keep the system away from any high temperatures. If you've got it in the dash of the car, the sunlight can affect electronics, and also the heat can denature the strip. So you want to keep it again, in the glove box or in a more cool, again, dry place. So yeah, because high temperatures, high humidity can really affect the test strips and affect the results.
What about cold, freezing? I mean, with the strips.
Yeah, the cold can also affect it. Technically, enzymes can be frozen and then thawed out, but they can be denatured. So we just want to be able to keep it in that good range, that normal range that's recommended for the test strips.
How about mentioning our super buy this week?
Yeah, that's a big thing. As mentioned, the strips are already 1/5 the cost, and now you're offering this special buy of buy one get one free. So I think that's just a fantastic opportunity to stock up on Easy Max test strips.
I'm seeing other manufacturers' products at $50 a package for $50, $100 or more for $100. I'm thinking, holy smokes! I can understand why people start to cry when they mess up one strip.
Exactly.
So anyway, what can you tell us in parting? How about you guys developing an A1C meter? Where are you guys at on this? Anyway, I guess we haven't talked about A1C. So.
Yeah, A1C, there are some technologies that's out there for A1C. It's obviously a little more complicated to create a simple test. But there is technology that's being worked on, and hopefully there'll be a home test at some point.
One of the companies, I think, had one out a few years ago, and I don't think it was very reliable. Right. And they disappeared off the market pretty quickly. But I just think that...
the only ones that are available right now are in a physician's office, and it takes 6 to 10 minutes for it to before they get an actual result. But they are very good, but they are run by a physician, and they require quite a bit of blood. It's like 10 microliters of blood.
Okay. Well, this has only been a few years ago that the A1C really kicked in as a knowledge factor for people. I was in a restaurant the other day, and I know the waitress very well, and I know she's an insulin-dependent diabetic. She says, I got my A1C down to 8.3, and I thought, well, I didn't say anything, but I was thinking maybe you better drive that thing down a little lower. And Nicole, what's the ideal A1C?
It kind of depends on, your comorbidities, your age, but in general, we want to have an A1C that's less than 7. That's the goal.
Well, that's what I was kind of thinking when she told me that. But
a little bit of work on the 8.3, but, she could have started at 13.1, and that was going in the right direction for her.
Well, I know. She was thrilled because she thought that it's taken me 9 years. I guess she's been an insulin-dependent diabetic for 9 years. She says, I finally got it close to 8 after all this time. So anyway. So, Doug, any parting information, need to remember, effects you want to leave our listeners?
Yeah, the other thing I want to say is that testing is a critical part of diabetes management. And, as Nicole has said, you need to test whenever you're feeling a little off. It could be going low, which could end up in an emergency room. You could go into a coma, or if you're, you know how high you are, so you can make adjustments based on your diet, the exercise. So testing is a critical part of diabetes management, and having an affordable system is really an advantage, so that people can test as often as they want.
So Nicole, you've been a frequent guest, and we love having you on the show. It just is such a big thing to talk about this stuff, and we do appreciate your partnership with Diabetes Education Department, Cleveland Clinic, Mercy Hospital. How can our listeners contact you and find more information about your practice?
They can go right to the Cleveland Clinic Mercy Hospital website. If you type in diabetes, it'll take you right to our information. Call me directly at my office at 330-489-1484. I want to kind of point out that we take all insurances, and most of the time your diabetes education is fully covered under your insurance plan. We always tell people to check to make sure, but very rarely are they not. And so even if you do have a self-pay, we offer a discount. So people, need to be aware that we're pretty easy to contact. Insurance is usually covered, and the one thing that we do need is a referral from your physician, just for basically to say diabetes education and, your diagnosis, and we can get you going. So please give us a call and reach out and, get yourself educated and let us help you.
Okay. Any other parting thoughts about diabetes?
I guess my philosophy in running this program is knowledge is power. The more knowledge you have about your diabetes, about your body, about, what you can do, the more power you have and the more control you have over this disease. So that's why I just would encourage everybody to, get educated and understand, all the facets and the parts of diabetes. And we're here for them.
Okay, super. Thank you, our guest, Nicole Solinsky, diabetes educator and licensed dietitian at Cleveland Clinic Mercy Hospital, and Doug Kuzik, Vice President of Business Development at Gemco Medical. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you right here again next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.